The second year of our 3-year digital strategy has seen us delivering on much of the roadmap we presented at the start and incorporating new objectives such as our collaboration with Southport and Ormskirk NHS Trust and adopting a minimum digital foundation package which will level up our digital capabilities to meet the standards expected by NHS England. I am delighted this year we have deployed CareFlow Workspace, providing one view of patient information to clinicians, so things like patients' observations, results, notes and referral information are all available on one page. We've further embedded order comms and results, which has seen our histology catalogue now fully digitised. CareFlow Connect is now also embedded, being used in innovative ways, and we've made great progress with the digitisation of nursing documentation, delivering efficiency and safety benefits for users and patients. I really want you to hear from my clinical colleagues about how our work this year has had an impact on the way they deliver care.
This year, I've seen great progress with digitalisation of the nursing admission form, completed by nurses when a patient arrives on the ward, and the social history and activities of daily living form. This is used across different departments and teams to start planning for when a patient is to leave hospital and go back to their own home environment. We are reaping great benefits from this, particularly in saving nursing and therapist time, compared to manually completing the different paper forms. This means more time can be spent with patients instead of on administration tasks. I am now assured that my teams have all the right, up-to-date information that they need, so this can assure best practice is being followed and they can act promptly when required.
Ward 3C is a diabetes and endocrinology general medical ward, and we've been piloting the documentation online. This has been really good and positive feedback from the patients because it's continuity of care, and also the nurses getting the time to sit with them and talk to them and they feel listened to. Also, when you move to other wards, all the information is on the computers so that it can be followed up. And anything that needs addressing is followed up there and then. So on the ward we've got 90% of our documentation digitised, which is so beneficial for the ward because everything is in one place, and nursing staff, doctors, anybody who comes onto the ward, visiting staff, can all see that it's online, and it's the continuity for the care of that patient is so good. We definitely wouldn't want to go back to paper.
And we use the social history and activities of daily living form on our wards. We call it the shadow because it's easier to say. We used to use many different forms on our wards. We had varying bits of pieces of paper, and the nurse staff had pieces of paper as well. So some of it was in their notes, some of it was in our notes, and we now use the shadow form, and it's one document on one form, so it's one version of the truth. Anyone can get onto it and amend things, and we know everything is right on there.
So we cover the stroke unit and as well a lot of the other wards in the hospital. Since using CareFlow Connect, we've been able to receive all of our referrals electronically, which means that we're not only able to receive them in a more timely manner, but we're also able to respond to our patients. So this means that even without seeing them face to face, even prior to seeing them when triaging, we're able to respond and provide the medical team or the MDT some further information. So this is something that previously wasn't as efficient and would often require us to go and see the patients face to face. So as well as this, we're now able to engage in a two-way exchange electronically so that all of the MDT can see.
So I've been using CareFlow Workspace for a couple of months now, and it's been fantastic. So I can open up CareFlow Workspace. I can then open up separate pages, EDMS, all the blood results, all the x-rays, and when I do my clinic preparation, I can then have all the pages ready and open and available rather than having to go back in and open multiple pages. So definitely saves me time, and I think the benefit of that obviously is even more efficiency, and then I can actually access patients' records quicker, and that the knock-on effect, obviously it's safer for the patient, and I'm more up to date with what's happening with the patient. So I can do that before the clinic, and then when I'm doing the actual clinic I have those open as well, and then that helps me to streamline the clinic and the admin side of the clinic. So no, it's been fantastic.
I'm really delighted to see all the progress that's been made in the last 12 months on our digital maturity programme, That's allowed our clinicians better access to information about their patients, which means they work more efficiently and improves the quality of care that they deliver. During the next 12 months, I'm particularly looking forward to the introduction of CareFlow Narrative that provides even richer information about our patients through data capture at the point of entry and allows us to get that information at our fingertips when we need it.